Okay, good morning, everyone, and thank you all for coming. I'm Brian Kerstetter. I'm the district attorney in Union County. It's an important day here in Union County because we're here to kick off the LETI program. For those of you who don't know, LETI is an acronym. It stands for Law Enforcement Treatment Initiative, and it's a collaborative effort between the Pennsylvania Office of Attorney General, who implemented the program, local law enforcement, treatment facilities, and the public at large. LETI is an additional tool that's available to law enforcement to divert individuals who are suffering from substance abuse disorders away from mainstream prosecution and into treatment programs in an effort to reduce criminal recidivism. Why do we need LETI here in Union County? As you all know, the drug epidemic is on the rise. Fentanyl and xylazine, which are very powerful narcotics, are making their way into other street-level drugs, including marijuana, and the effects of that are becoming increasingly deadly. Just by way of numbers, in 2023, 33% of the cases that were handled by my office involved a charge under Pennsylvania's Controlled Substance, Drug, Device, and Cosmetic Act. In 2024, thus far, that number has risen to 48%. So the need is certainly there, and it's very real. Those numbers don't include offenses that may have occurred as a result of an addiction, such as someone committing a theft to support an addiction, if it didn't involve a charge under Title 35. So those numbers may actually be very low. Our treatment court program in the 17th Judicial District has been very successful in reducing recidivism, and LETI is, of course, a natural precursor to that program. Now, LETI consists of four separate tracks, or I'll call them methods, by which a person with a substance abuse disorder can enter the program. The first track is a referral from a community member or the individual who's seeking treatment, him or herself. The second track is following police contact. The third track is after the filing of charges at the magisterial district court level. And the fourth track is generally participation in our drug treatment court program. In all of these tracks, save track 4, an individual who successfully completes an approved treatment program, the charges are either never filed or they're dismissed. And that's obviously a significant benefit to the person who is suffering from a substance use disorder. And while our treatment programs, again, have been very successful in reducing recidivism, folks who are involved in that program still have convictions that they have to deal with. The hope is that LETI will relieve some of that. If the treatment program is not successfully completed, then the individual re-enters mainstream prosecution. So it's sort of a stick and carrot type of approach. So that's a little bit about the LETI program. I'm honored to introduce to you Attorney General Michelle Henry, who will also have some comments.
Well, I have to say I'm really excited to be here today in Union County to launch this important program. It is one that we have been working towards having happen here in Union County, and I appreciate that the district attorney is willing to do this and has partnered with us in such a great way. There is some sadness, obviously, with this. I had this scheduled with the former district attorney, Peter Johnson, who was very much supportive of this program. So I feel like we're carrying on his wishes here in Union County by making this happen here today. You know, the truth of the matter is that we can't combat this opioid epidemic without a coalition like the partners standing behind me who are going to work together. I can say, as a longtime prosecutor for over more than 20 years, I saw firsthand what the reality was, and you've heard it here before, but you can't arrest your way out of this problem. You just can't do that. And when I was early on in my career as assistant district attorney, I would see individuals that would come in, they would get charged with a drug charge. They would go before court, either take a trial or plead guilty. They would be sentenced. And in short order, they would be back. They would reoffend. It was like a revolving door, the same individuals. And while there was sentencing, there was no help. There was no offer of treatment. There was no open hand to say, come this way. And that really had an impact, and I think really, created issues. So there was no recognition at that time that what these individuals were struggling with was an addiction that demands treatment to be resolved. And that's really what the LETI program is about. It's about removing the barriers that prevent access to treatment. And with the opioid epidemic killing 14 individuals in Pennsylvania, we really want to bring this LETI program to as many counties as we can and towns. At the Office of Attorney General, we continue to try to address this problem on all fronts. So we still go out and we address the drug dealers that are on the street corners peddling this poison. Our narcotics agents are out there every single day arresting and charging people. We also have gone after the drug companies to hold them accountable for their role in this epidemic. And then finally, we want to bolster treatment. We want to open up the doors so people that need treatment can get it. We went to battle with large manufacturers like Purdue and forced them to pay for what they did in this, what their role was in this. And I'm proud to say at the Office of Attorney General, we led a national coalition of AGs from across the country. And we were one of the leaders in that to secure more than $25 billion from the drug distributors, with over $1 billion going to Pennsylvania to fight this crisis and get the monies to these communities. And I will say that money is marked to help people that need it, to help the communities and to deal with the ramifications from this opioid epidemic. It is not there to pave roads or to help PennDOT. It is solely earmarked for this one reason. And right here in Union County, over $20 million is coming to Union County as a result of that settlement. And as the district attorney rightly noted, with fentanyl replacing heroin, our B&I agents seized more fentanyl last year than it had in the 4 years combined before that. So, we look at what the problems are, and this is a really diverse state. As I travel throughout Pennsylvania, it's a big state and it's very diverse. So each community struggles with different issues, but I know that every county's needs are different, but with LETI, the critical piece is opening the door to treatment. And I understand in Union County, the common drugs are alcohol, methamphetamines, and opioids. And LETI is a key part of combating that problem. And so, again, it focuses on accessibility. Sometimes people who are really suffering, they don't know who to turn to. They don't know where to get help. And today, the district attorney and the law enforcement professionals behind me are saying, you can turn to us. And that's incredible. We first launched it in 2018 in Somerset County, and we now have 29 counties in the state that have this program. And under the leadership of our strategic initiative operator, Lauren Diller, it combines this ability to help law enforcement connect people who need help to the county drug and alcohol treatment centers. So everybody's working together. And this policy, led by the district attorney's office, also enables other stakeholders in the community. So any individual in the community can shuttle individuals who need treatment. They can open that door, and that's really important. To date, nearly 1,400 individuals have been referred into treatment using LETI and are now working toward recovery. And that's a powerful sign. We're here to help, and we are here to work together to battle this on all fronts. So I just have to say thank you to Union County, the District Attorney's Office, for becoming the 29th county to join in this important program. I'll turn it now back over to the District Attorney. Thank you.
Thank you very much, General Henry. You're going to hear from a couple of folks here, folks that are standing behind me at the moment. The first one is Chief Paul Yost from the Buffalo Valley Regional Police Department.
Thanks, Ron. Morning. Happy to be here and part of this program. I'd like to thank the Attorney General, Sean Henry, and District Attorney Brian Kerstetter for bringing this needed program to our county. As the Chief of Police, I recognize the need for such a program. Being on the front lines of the opioid epidemic, police officers have had a limited resources to get people the help they need. Pennsylvania Department of Health indicates that since 2018, there's been over 96,300 doses of naloxone provided through emergency services. That was our first ability to try to help with this epidemic. Every day, over 14 Pennsylvanians lose their life as a result of overdoses. Everyone by now has been touched or affected with someone who has issues with addiction. District Attorney has taken numerous steps to keep drugs off the streets and a strong stance against those illegally distributing narcotics in our county, and I'm sure that will not change. The LETI program does not address those type of offenders. It is designed to address those with a substance abuse problem. LETI will provide a tool to police to better serve the community. The LETI program will provide another tool to police that now with people with addiction will have no fear of an arrest and can come talk to us. Individuals will be able to come to the station or approach an officer on the street, and we will be able to help them. Addiction is an issue we deal with every day in law enforcement, and we, as a district, we know this causes the criminal activity that we also deal with every day. We have learned that we cannot arrest our way out of this epidemic. Early intervention is a key in drug and alcohol recovery, and LETI allows law enforcement a referral without introduction into the criminal justice system if the program is completed. LETI will allow residents of Union County to look to law enforcement as a resource for making contact with participating treatment partners without the threat of an arrest. LETI will also allow family and friends to get involved by breaking the addiction cycle. In the past, we have struggled to find or locate proper treatment initiatives, and LETI arranges the immediate resources to us. LETI provides a detailed procedure for our officers to get addiction individuals the help they need immediately. I appreciate the continued support and the amazing working relationship with the District Attorney's Office has with the police in this county. I look forward to implementation of LETI in the county and excited to see the impact that we can have. Thank you.
Thanks, Chief. Thanks, Chief Yost. We have another chief from Union County from the Mifflinburg Police Department, Chief Jeffrey Hackenberg.
Thank you, Ron. I will keep this brief, and I didn't use big enough font, so bear with me. Good morning. I'd like to thank everyone for coming today, and I'd like to welcome the Attorney General and our staff to Union County. When Chief Yost and I and Pete Johnson first met and listened to Dr. Holder's pitch regarding the LETI program, I think we were all likely a little skeptical. Just another feel-good program that would make nice headlines, but lack any real ability to make any change. I think we both left that meeting with a different attitude and are hopeful that this program has real potential to achieve what everyone wants, which is to make our streets safer and improve the quality of life for our citizens. The problems facing small rural areas are no different than those of the big cities. It just takes a little longer to get to us. And once they're on our doorstep, we have less resources to deal with them. The LETI program is the definition of community policing. It gives us a chance to be one of the first steps in the recovery process for addiction. Often our hands are tied when it comes to what we can do and when we deal with the drug epidemic. Usually by the time the police become involved, it's reached the point where it has become our duty to effect an arrest, leave it up to the courts, and hope for a good outcome. Sometimes you just flat out feel bad for having to arrest someone, especially when it may be a resident you've known for years or a young person you watched grow up in the town or the community. It's my hope that LETI will put a certain amount of discretion into the officer's hands and allow us to be an active part of attempting to break the cycle and get people the help they may need, as opposed to incarceration and mounting fines and court costs. I'd like to thank, here you are, District Attorney Brian Kerstetter for being proactive and supportive of our efforts, and I look forward to a successful implementation of the LETI program. Thank you.
Thank you, Chief. The next person that you're going to hear from is Gina Malone. Gina Malone is currently in recovery. She's in long-term recovery. She has lived experience. As I understand it, Ms. Malone is pursuing her degrees, whether they be bachelor's degrees, master's degrees, or both, from Walden University. She's currently working as a clinician at Gaudenzia Outpatient in Lewisburg. Gina is also a previous graduate of the 17th Judicial District Drug Treatment Court program, so she will really have some interesting insight for you as to how that program impacted her and how LETI may impact folks like her who were similarly situated. We're very proud of her, so I'll introduce to you Gina Malone.
So first, I'm really, really excited to be here. It's a pleasure to be here, and especially hearing, the DA, the Attorney General, and the officers behind me and their support with this program. I, many years ago, would have loved, even before my treatment court days, to have something like this in our community. I see a lot of this in our rural communities of the lack of the resources, and we're trying, we're growing, we're doing everything we can do as a community, and especially with reducing the stigma. And that's one of my biggest things, is just the stigma reducing, and I like that. That's one of the goals of LETI. So many years ago, I would have never wanted to walk into a police station and ask for help. That probably would have scared me more than anything, especially anytime I had to turn myself in. I know that fear, and I sometimes thought, just catch me, or maybe I will turn myself in. So having these resources, a program like LETI, for individuals who are already shamed, scared, dealing with adversity in their lives, whether it's from childhood or currently or whatever they're enduring. I mean, there's already adversity when we're dealing with substance or alcohol use disorder. So for them to have this, let me walk in and ask for help instead of fear of being arrested, is huge. That's going to break many barriers, just like some of the officers behind me had mentioned. I've seen barriers in my own, experience with trying to reach recovery. So actually stepping foot into recovery was when I was on treatment court. I didn't feel judged, shamed. I could ask for help. I see very familiar faces in here that helped me tremendously during my time of struggling. And it didn't happen overnight. It took many years. Even a person in long-term recovery, every day, I'm still reflecting back to what I learned when I was in treatment. So treatment, for me, was rocky at first. But as time went on, I took it serious. And if I would have just been thrown in and out of our county jails or our state prison, who knows what would have happened. So that opportunity for me to apply the skills and develop coping skills and work on my own adversity and be able to apply that in my daily life is what made me today. I also have experience with LETI, as I was a case manager briefly. Well, it was more than briefly. It was a couple years right after COVID. So towards the end of 2021, I started working with Northumberland County. So I did extensive outreach, went around from Cole Township to, oh my goodness, it's been so long now because I haven't been out there, but Cole Township, Shamokin, Coltmont Police Departments, all over, and advocating. And I got different responses. I've had many great conversations of opposing, the punitive side and the therapeutic side. And I'm like, well, let's come together, right? Can we come together and make this happen? And I've heard great points. So, but I love the challenge and I love the challenging conversations. And then seeing that officers were using the referral and seeing the success and having officers call or email and say, Gina, I had an individual come up to me in the community. And they were surprised, right? That fear and that barrier of law enforcement and, civilians who are still actively using or struggling with, stepping foot into recovery. And they were able to reach out and ask for help and made sure that we thank them tremendously for welcoming them and making them feel welcome and allowing them to reach out for help. So right there shows. And even academia, when we would have these referrals in all of our facilities, no matter what county of LETI that they are in, we're seeing success. And we're seeing them have that initiative that kind of gives them a little bit of that external motivation that sometimes we need. We're not always coming into recovery with all this internal motivation. We have many other things that are going on in our hearts and our minds. I'm excited for Union County. I kept saying to Dr. Holder, like, when are we going to get this in Union County? I was really, really excited. I live in Union County as well, so I see it. The familiarity, even from Mifflinburg to West End, our Lewisburg clientele, and seeing the resource and benefits that we need to help them a little bit more as a community and how that would benefit them. And, especially it's very rural, once again, a lot of our local communities. So I'm really excited to have this in Union County and to see the success and to partner with everybody here and even the community, just spreading the word in the community. Like, you don't have to have a reason. Anybody can make a referral, which I think is great. So I'm happy to be here, and also just knowing that it works and, no matter how much hard work, but treatment is the answer. So I appreciate, again, I really do. I appreciate the DA and the Attorney General and the officers standing behind me being on board with this. I think that's great and that's huge. And we're making changes in reducing the stigma of addiction. But that is all.
All right, thank you very much, Gina. What an interesting perspective from someone who's actually been through it and can give you real life details about how these sorts of programs have affected her and the effect that we hope this is going to have on our community. So that's it. That's the program that we have. I want to thank the Office of Attorney General for implementing this program, and specifically Attorney General Michelle Henry for being here today. As she indicated, the LETI program is something that my predecessor, Pete Johnson, felt very strongly about implementing, but because of his untimely death, simply never got the chance. I'm honored to see to it that his wishes are being carried out. I'm even more honored to have his wife Paula here with us for this, so that she can see this matter brought to fruition. So again, I want to thank you all very much for coming, and I will stick around, and I assume that the chiefs will stick around for a little bit if anyone has any questions. So again, thank you all for coming. Who are involved in that program still have convictions that they have to deal with. The hope is that LETI will relieve some of that. If the treatment program is not successfully completed,
Opioid epidemic without a coalition like the partners standing behind me who are going to work together. I can say, as a longtime prosecutor for over more than 20 years, that need treatment can get it. We went to battle with large manufacturers like Purdue and force them to pay for what they did in this, what their role was in this.
Steps to keep drugs off the streets, a strong stance against those illegally distributing narcotics in our county, and I'm sure that will not change. The criminal activity that we also deal with every day. We have learned that we cannot arrest our way out of this epidemic. Early intervention is the key in drug and alcohol recovery.
Definition of community policing. It gives us a chance to be one of the first steps in the recovery process for addiction. Often our hands are tied when it comes to what we can do and when we deal with the drug epidemic.
I didn't feel judged, shamed. I could ask for help. I see very familiar faces in here that helped me tremendously during my time of struggling. In and out of our county jails or our state prison, who knows what would have happened. So that opportunity for me to apply the skills and develop coping skills and work on my own adversity and be able to apply that in my daily life